Hello and welcome to this CG podcast. My name is Toby Green and I'm a member of the Scientific Advisory Board for Collateral Global, and it's a great pleasure to welcome Daniel Briggs to this podcast. Daniel, welcome to CG Podcasts.
Great. Hello. Thanks for having me.
It's a real great to have you here. Great to have you with us. And Daniel is the lead author of a fantastic new book, which is going to hit the streets and the shelves in the middle of December. It's called Lockdown: Social Harm in the COVID Era, and it's published by Palgrave MacMillan. So, Daniel, perhaps we could start by, if you could introduce yourself and your expertise to our viewers and listeners.
That's great. Obviously, first of all, thanks for having me, talk about the book as well as the findings of the research. It's been really difficult for me to get attention towards what I've been finding over the last 18 months, or even generate any kind of interest in the public sphere. So really grateful to Global Collateral for that. I normally would be an ethnographer who would be sniffing around the dark corners of the world, finding out about things firsthand from observation. Some of the things I've done over the last few years pre-pandemic were related to drug addiction. I did a study of 2 years in Spain's largest drug market. Spent 3 years going around refugee camps and substandard housing in Europe, examining the experience of the refugees arriving in Europe and what happened to them. So this is what I would normally be doing. And obviously, when we were thrust into a lockdown, I wasn't able to go out of my house. So I had to adapt how I research almost. And when I started looking around me and talking to my colleagues who didn't seem to be doing much, I put them up on myself to return to my roots as a quantitative researcher and launch an online survey, which I was surprised very quickly received a lot of attention. And the online survey captured really people's experiences of lockdown from different parts of the world. Over the last 12 months, that survey accumulated 2,500 participants from 59 different countries, a range of people from different social positions, economic statuses, ages, all sorts. And also complemented that with 59 Zoom interviews, as we are having now, Toby. And for my penance, spent over 400 hours in COVID-19 Facebook forums, which was really challenging. And of course, when we were able to go out and, we were let out of our houses, I was able to complement that with firsthand observations of how the residue of all this is now playing out on the streets.
So, I mean, this is really important. So the first thing to say is, that this book is built on, a really extensive amount of research into the social impacts of what's been happening the last 18 months. And I think it's also worth saying, because you're based in Spain, aren't you, Daniel? So you've obviously got the perspective. Obviously, the Spanish lockdown of spring 2020 was, one of the most severe in the world. So was that one of the things, in fact, which made you begin to question the policy direction?
Yeah, I mean, even before the pandemic, myself and my colleagues, because the book is co-authored with 4 colleagues from the UK who also offered that UK perspective as well. Even before the pandemic, we were our work was very much critical of political institutions, very much not accepting things face value. And so why would we change that approach when these lockdowns came? I'm sure there was a lot of worry and concern initially, but very soon, as you know, Toby, we realized that this virus was most risky to very elderly, vulnerable populations. And we saw quite disproportionate measures being taken. And at the same time, this was basically why we launched the study. And we weren't prepared to wait around for any funding call or any ethics committee or bureaucratic process, which was going to delay us. We took upon ourselves to basically do this unfunded as it was happening and follow it as far as we could. Because, this is one of the reasons why social science has also failed to conceptualize what's going on, is because everyone's sitting at home and waiting for, to be told what to do, or, they're now thinking about submitting something for a very limited funding call. And, we have to act now.
Well, I completely agree with you. And just before we get on to the detail of your approach in the book, I think it's important to talk about this, the social science, the complete failure of social sciences, utter, complete, catastrophic failure of social sciences to do what they're supposed to do. I mean, decades of research has shown the clear relationship between wealth and health. And yet, at the start of the pandemic, we were being told, oh, well, we can either protect health or, save lives or protect the economy. And that's a sort of right-wing thing to do. And, this is so contrary to decades of social science research. Why do you feel that social scientists just accepted that? And even championed it?
Yeah, no, there were a lot of people applauding the lockdowns and, even sort of canvassing and promoting mask wearing and things like that. And to us, it was a stark representation of how embedded academic capitalism is in that is the kind of how universities are run according to a business ethos, which essentially over the years has completely numbed and sort of straitjacketed critical thinking, or as people come into this kind of academic world as well, how they're trained or not trained. So it means that people less and less in the academic sphere are shunted into doing particular types of research, which is mostly funded, and to spend time doing bureaucratic things, satisfying students and all this sort of stuff. And it takes them away from what they actually entered into the whole thing for in the first place, which is telling it how it is, finding out how things are working.
I mean, it's interesting what you say also about funding. Just finally, not to bore our listeners who aren't really interested in academic politics, but at the same time, it is important to recognise the funding represents government priorities, and I don't think that governments have as a priority really investigating what's gone on here. So that's why it's so important that people like you are doing this research independently, and also Collateral Global, we don't have government funding so that we can do the research we're trying to do independently. And I think, do you feel that independent research is going to be like this, is going to be vital to really analyse what's happened?
Yeah, I mean, in many ways, it's kind of anything that's produced, even these YouGov polls are immensely questionable about how they're done, or, what they show, because obviously, if you're doing something which is funded, then pretty much you're guided by your funder. And I can tell you that from my own experience, having done research for the Home Office, Youth Justice Board, many years. I've spent churning out reports for government institutions, and they haven't liked it, or sometimes altered or interpreted things differently. So in many ways, we do need that independent voice to do things.
Yeah, and like you, my book on COVID wasn't funded either. So yeah, I think it's interesting that that's the reality of what's being produced. So let's talk about your book then. And let's talk about your approach to COVID. So first of all, of course, this is presented, or was presented, as we know, in the beginning of March 2020 as a tremendous threat to human livelihoods around the world. And yet, in your book, you're trying to provide a critical assessment of the question of risk and how risk was assessed in all of that. So, what do you think about how that was portrayed, and the lack of any real reliable data as when that began to be rolled out?
Yeah, I mean, from the instance, I think there was a very early study in China which basically gave us a clue to who this was mostly affecting and things like that. Even thereafter, studies in Italy confirmed that. And even within a few months, you could see that the average death of a COVID patient in the UK was 81, I think, or the average life expectancy was 82. And even in Sweden, which didn't lock down, the average death of a COVID patient was 84, and the average life expectancy was 82 or something like that. So you can see these studies, which weren't arriving into the public sphere, were confirming very much that this was something, quite deadly, but also natural, because viruses are a natural way, naturally transmitted, and people suffer naturally from them. I'm probably going to be a victim of abuse now, but my wife tells me that her grandmother used to call pneumonia the old man's friend. I mean, that was how they used to be seen. Yeah, I mean, look, well, we can all point the finger at politics and the media, really, and how they've created this ideological storm around the virus, which is now embedded a lot of fear and panic and concern about the fact that it was portrayed to us like anyone could die at any minute, and there was no context to the kind of risk or how we could get this. Even if you go onto the WHO website, there's a list of so many different symptoms. So it could randomly hit anyone, and even now you get these anomaly case reports in the media. A girl of 30 died of COVID. A Christian who didn't believe in COVID dies, and it's like, well, look at the statistics, look at the real facts, look at the context.
Yes. So what do you think about in your book and your team, did you draw any conclusions about, as social scientists, you and I, we're about providing context in the end for what happens in society and understanding that. And there was this complete lack of context, as you say. So did you draw any conclusions as to what drove that and what the consequences of that were?
Yeah, I mean, it does look like, I think politicians got very fearful and caved to a particular side of science without letting other elements of science come forward to debate, like, the seriousness of the virus and the even kind of approaches that should be taken. So it just felt like as soon as one or two countries started locking down, that there was this domino effect, and other countries did the same. And of course, these countries have political agendas as well. Suddenly, you close a country down and, you have additional power, and pretty much I think that's what's happened, is that governments have exploited everything since the lockdown with a lot of these measures, and it's become much more than a deadly virus, and we're now into a very different territory with QR codes and digital passports.
Yeah. Well, look, let's talk about some of the findings in your book. I mean, as you say, you've done a huge amount of research, and you've got a lot of feedback from different people to your survey. So, I mean, obviously, you can't tell us about all of them, but if you had to sort of, pick out 2 or 3 examples of the kinds of impacts which this had and how people responded to your survey, what was the response like?
Well, it's curious because obviously the book, what it does is tries to present different populations of people and how they were impacted by the lockdowns and the virus as well. So first of all, it talks about how perhaps like people like you and I, middle class people living in society, lockdown, Netflix, we had to work from home. It was
home deliveries,
teaching and online classes, we can't really complain when, as I therefore cover later in the book, elements of sections of society who are really impoverished. People on the front line, like care workers. I remember this interview I did with this care worker in the UK, and she was having to isolate. She got COVID, and she was under pressure to support the care home by continuing, and at home as well because of the lockdowns. Her daughter was taking overdoses and, suicidal because she had mental health illnesses, and, these kind of stories. And you really understand the moot point of a lot of people. Another interview I did with a guy from Pakistan, Hamza. He was working as in a restaurant across the other side of the country, sends home money to his family. The lockdown, he couldn't not only see his family, but he couldn't earn money or send money to his family. Of course, there's no government handouts in Pakistan as well. So, they were facing starvation. So really tragic stories, and obviously the idea of the book is just to take people out of their personal comfort zones, because it's very easy to say, oh, look, it wasn't so bad, or okay, yeah, I wasn't able to go out. But if you look beyond yourself, like what was going on around the world, it's really quite troubling.
Yes, I think that's right. And were you surprised at the? I mean, you sound as though you were quite surprised by the sheer volume of responses you got, to the survey. Was that something which surprised you? And what do you put it down to?
Yeah, I mean, we were surprised really because no one really likes surveys for a start. But I think the design, and obviously because it was a hot topic, everyone was going through it. The design of the survey was meant to act in a way so that people could really express themselves openly. There were a lot of open questions, a lot of space for people to talk about personal things. Of course, it was anonymous as well. And people wanted to, it was like that solidarity we had in the early period of the lockdowns. It felt like there was a lot of solidarity online in this respect. The people actually, made a lot of new friends from this study as well. People now I still follow who are still suffering in many ways from the pandemic, who literally just filled out a survey.
Could you just take us through that a little bit, actually? Because it would be interesting to know how you found the responses change over time. What, were there differences in the ways people responded in, say, July 2020 to the end of last year, beginning of this year? And what has the trajectory of some of your respondents been in the last 18 months?
Yeah, it has been interesting because you have a small proportion of quite resolute people from the beginning, perhaps like myself, questioning it a lot. And now they're in the sort of stage of not wanting the vaccine and, really quite resistant to everything. You have another group of people, I think, that early on had questions, but, just wanted to conform and get through it and, return to normal as soon as possible and have the access to all the things that they wanted. And you had a kind of ultra-conformist group who were basically saluting all the measures and going around almost like instructing other people on how to do stuff. But of course, all these like 3 different groups or 4 different groups, they're very much, a response or kind of a representation of this ideological discourse that was coming from governments, the responsibilization of health on an individual. And of course, they were blaming us for transmitting it and things like that, or if people didn't follow the rules, that was how the transmission took place. And again, a lack of context.
Yeah. Okay. Well, look, I mean, as you say in your book, your team of authors, you look at some core affected groups. So maybe we could go through them and discuss a little bit about your findings and what you found. So, I mean, we discussed before, and there were 4 groups you particularly wanted to focus on, Daniel. So Western society as a whole, then care workers and vulnerable adults, then prisoners and youth detainees, and then migrant workers, refugees and homeless. So why don't we start, go through them in that order? So what about Western society as a whole,
without, obviously that's quite a big group to cover, but quite quickly, and I suppose this is some way of explaining the division we now experience, Toby, is that you had a lot of people who are at home and only exposed to these sort of government briefings, pretty much working online, homeschooling and things. And a lot of these people had to kind of take things quite seriously. They didn't have experience about what was going on outside. On the other hand, you have a lot of people working on the front line, care workers, delivery drivers, and these people were exposed firsthand to what was going on. And this is, I think, this part of the book tries to explain how those 2 groups grew apart almost, because you have a group of people, inside and worried and sort of panicked. And even now in my local towns, a lot of them still wear masks around here, even though you don't need to wear masks outside. And another group of people who are just realizing, I think, quite quickly, okay, well, it's not so bad, or it's part of life. Let's try and get on with it, because they had to. They had no choice. They had to be delivering stuff. They had to work in supermarkets and things like that.
I mean, I think it's right. I mean, somebody, I saw a tweet of some kind. Somebody said, there was no lockdown. Middle class people stayed at home, and working class people brought them things. And that's a pretty good summary of what actually happened. And of course, that's one of the really interesting things, isn't it? That as you say, there was this division based fundamentally around class, and very quickly, of course, as is always the case, it's actually working people who come up against the illogical nature and the contradictory nature of policy. So, for example, I remember somebody came here to mend a washing machine and said, what I can't understand is how I can go into 20 houses a day to do this, but I'm not allowed to have coffee with my parents at the weekend. Yes. And, the irreconcilable contradictions in this policy, which were opened up and then manifested through class. So did you see also in your research, as you say, a greater kind of, far from bringing people together, which was the initial kind of ideological framework of it, is that a greater fissure? Is that a fair comment of what's happened, do you think?
Yeah, definitely. And you can see this all played out as well in public spaces. It's the contradictions of from the restrictions are really quite evident. Like, for example, like as you say, with your experience, I regularly fly to Mallorca, and people come up and down these attendants, and they boss you into the social distancing, and then you get on a plane and you're just centimeters next to each other. So even like when you go into a bar, you go with your mask on, and then you take it off to eat, but then you put it on to go to the toilet. But there is, immense conformity to that still. And on the other hand, other people are completely doing the opposite and flouting it. So
there's the fissures are opening up.
Yes,
so it's,
big division.
and I think yes, and that's something which is contrary to this idea that we were all in it together, which I don't think anybody really subscribes to anymore. Even those who've gone along with things, I don't think they would subscribe to that anymore. But well, so and then you're somebody who as you say, done a lot of work of different kinds related to sociological questions. So the question of vulnerable adults and care workers, what did you find about that, your team, in this survey and response?
The lockdowns, and again, I don't think this was thought about properly. Certainly wasn't much decision making or strategy for people who, elderly people or vulnerable adults, and how they would get care, or how important like social contact was for them. A lot of people left out on a limb, which I would say very much form part of the excess deaths we now see over the last 18 months. Everything went online, and some people didn't understand what Zoom calls were or digital means of communication. Physical contact is what a lot of elderly people were used to, routine and this sort of thing. And you had the care workers on the front line trying to deal with the sort of diminishing health of a lot of these elderly people who, on one hand, were dying, perhaps with or of COVID, but on the other hand, were also dying of loneliness and delirium and a lack of contact with their family. And
so did you have, you say you had some care workers respond. What kind of story, were they telling you stories about that kind of thing, about the isolation of elderly people? And
for sure. And, we had even care workers tell us basically firsthand that they were questioning the whole lockdown, the whole response, and why people couldn't come in, or why they couldn't at least make the decision to come in or see their family or take the risk, because a lot of the people didn't see their loved ones before they died. I interviewed a lady from Madrid whose both her parents died in a care home because the staff abandoned the care home. They just left.
These kind of stories are extraordinary. And it's interesting because being based in Spain, it might be interesting for some of our viewers and listeners to think about. There's been quite a bit of focus in the UK on the care home situation, but was it pretty much identical in Spain? Were there any differences?
No, it's very similar. We're talking about an industry which is massively underfunded, massively underappreciated. There's a very awkward stigma about working in a care home. It's considered a really low substandard type of job, and that's reflected in the conditions and the pay, really. And then you may criticize people from walking away from it, but on the other hand, if you look at the circumstances in which they're working and how they're treated, maybe it's not necessarily justifiable, but a little bit understandable.
Yes.
Very troubling.
Yes. So, and I know from talking to friends, for example, countries we wouldn't necessarily associate, or people in the West wouldn't necessarily associate with this, like Cape Verde. I know that actually was a similar kind of situation in Cape Verde, in that where there was sheltered accommodation. Again, people were isolated. So this was a very you say shocking cruelty essentially being inflicted on older people.
Obviously, the book, as well as if any lesson we've learned about the care of the elderly, it's obviously we should appreciate a lot more the way these people put themselves on the front line, the way they care for the elderly, but also is that really how we should treat people as they die? It's a massive question. Is that really how people want to sort of leave the world? And why has there not been an investment into those sectors? In the UK now, aren't they sacking 60,000 people for not having the vaccine? Care workers, people that they actually need.
It's an extraordinary thing, and actually, it's interesting here in the UK. Yes, as you say, a large number of our care workers have lost their jobs. As you said earlier, a number of them were already infected with COVID, and studies are
had
coming
the
out
antibodies.
day by day. There was one in
Yeah.
Nature just a couple of days ago talking about the longevity of natural immunity, and they don't want to have, therefore, they don't need to be vaccinated, and yet they're being dismissed. But of course, what's happened, that's going on, and there must be an unbelievable crisis in care homes as a result. But it's not in the news.
No, nothing. It's really hard to. You have to dig for the information, as you know, Toby.
Yeah. Well, now you've done a lot of work in the past, as you say, on you're actually a criminologist by training, and actually your team is a team of criminologists. So, and so the third topic you highlighted with prisoners and youth detainees. I mean, you must have had quite a lot of insight into what happened there. What kind of material did you discover?
Well, I mean, obviously it was quite difficult to go into prisons. So what we did is we relied on some people who filled in the survey. Actually, I interviewed a guy called Sunan from Thailand he's an NGO worker in a Thai prison, basically, and he was sort of talking about his experiences of the overcrowding and how the virus started to go through the prison. And essentially, I don't know if you know about the Thai situation, but over 300,000 people are in prison in Thailand. It's got one of the highest rates of imprisonment. And all sorts of health complications people in prison have. But the government were under pressure to release some 50,000 so that the overcrowding wasn't so bad, and at least they could start managing the virus. But essentially, they didn't, because obviously people in prison who've committed crime are disposable populations. So they just let the virus go through, and nothing was published. But he said he saw a lot of people, affected by the virus and pass away. Obviously, they had other complications as well. And there was this really tokenistic gesture from, I think it was the World Health Organization, which donated 1,500,000 masks to the prison. And when you do your maths, that can only last each person for 5 days. So it's really pointless. And they're standing there in this nice photo, being proud of this gesture. And it's like, well, that doesn't do anything really.
Yeah, I mean, it's interesting, the question of overcrowding. I mean, and talking about the global south, a number of the countries which have had really high excess death rates, as well as high, severe restrictions. We can talk about Peru. We could talk about Colombia. We could talk about South Africa.
Yeah.
And of course, the reality of restrictions in countries like that is that people are being forced into very cramped accommodation where it's actually worse for them than if they were allowed to circulate normally.
Yeah, and it was the same in Canada. Interviewed a prison chaplain who wasn't able to go and visit and support emotionally and psychologically a lot of his clients and friends who were actually in prison, some of them quite young. And, he had heard reports of suicides and things like that. Of course, nothing in the media, no explanations, no investigations. So it's very sad. And even in the UK, I did another interview with a youth offending worker who goes into prison. A lot of them had sort of failed by the services because they couldn't go and see them. A lot of resentment, increased self-harm and suicide. So it's really, when you go beyond, your little personal bubble and you start looking more specifically at how this really affected, quite vulnerable people, it ruined them.
It ruined them. I think that's absolutely correct. And I think the first stage, that society as a whole has to go through is to acknowledge that. I can't see, which is why your books like yours are going to be so important in that. Well, and then the fourth category we'll talk about is that of migrant workers and refugees and the homeless. And how did you manage? I mean, that must have been a particularly difficult group to get responses from. So how did you go about that?
Yeah, I mean, I was fortunate with the migrant workers. I mentioned Hamza earlier on, who I interviewed from Pakistan, but I also did an interview with an unemployed waitress in India who talked about a lot of what she was seeing in the country. And obviously she was now spending her savings because she had not been sort of properly supported by the government. But she drew my attention to a story whereby migrant workers had to, because of the lockdown, walk from one side of the country to the other. I said, really? That's crazy. And she said, yeah, this was just one route, but all over India, hundreds of thousands of migrant workers were trying to get home. I said, okay, so what happened? She said, go online and find out. So I looked up this story and I found out on this just one railroad, because they couldn't go on the roads because of the police controls, and they'd be arrested and things and put in prison. So you went on the rails, and over 8,000 people died on that one rail track trying to get home. They died of hunger and exhaustion. And
well, I mean, you say I have received an email from somebody who works on human rights and justice in India, describing, I mean, this was 6 to 8 months ago now, but at that point saying that there are literally millions of people in that kind of situation in Uttar Pradesh alone by the roadside. I mean, it's quite, I mean, it's just beyond belief, I have to say. And yes, so how did you approach this in the book? I mean, it's such a numbing and disgusting situation. But so what's been the approach in the book of your team to that?
Well, I mean, the idea was to, she talk about the jolly existence, this middle class experience to start with, and then gradually go further into the darkness, into the really disturbing corners of the world. And when it comes to like even the refugees experience, we interviewed a guy who works in a Syrian cafe, works illegally. I'm fortunate to still know him from my refugee study.
In Madrid? Or
no, he works in Munich, in Germany, in a Syrian restaurant. I met him there some years ago. So I interviewed him again. I said, okay, well, how are things? He said, everyone's worried about this COVID thing, but, we just have to battle on. I work in a restaurant. I do deliveries, and it's really strange when I have to turn up to people's doors and they've got all masks and gloves and they gel their hands as if I'm the leper and I'm the infected one. And it's true, and it gives you another example of this other side of the pandemic. You had people like that working on the front line. And, the guy is very clever. He was talking about, this is much more about business. Look at the behavior of the pharmaceutical companies. It's giving you a lot more context. And, he put me in touch with his sister who was in Damascus.
Sorry, go ahead.
He put me in touch with his sister who was in Damascus, and they don't even wear masks in Syria, and there's almost no vaccinations. I think in one area of the country where 3 million people are, they sent about 20,000 vaccinations there. So that's not going to do much.
No, and as we know, well, anyway, that vaccination's is a whole different issue. We won't. Well, look, I mean. So, I mean, interesting listening to the discussion about the migrant workers and refugees. I mean, of course, it again exemplifies what we were talking about earlier, this fissure in society as it's opened up. I mean, let's be clear. Of course, there were huge fissures in societies already, but I think one of the phrases I used in my book was, to say that this has exposed it is rather like saying that an earthquake exposes a crack in the earth and turns it into a chasm. I mean, that's that, and it's quite hard to see that how that can be bridged. So, I mean, let's talk about the residue of this and what kind of aftermath we might be going into, in your view.
Well, I mean, you said let's not talk about vaccinations, but now is the topic really. This is the consequence of I don't know. It feels like it's a bit of a global competition going on. Who can get the most vaccinated. I don't know. Obviously, it's big interests, massive conflicts of interest as well on the behalf of some politicians or scientists involved in recommending these restrictions as well. But unfortunately, I think things are going to get pretty rough. I'm now actively doing another survey, another study on the anti-vaxxers, this community of people who, for some strange reason, don't want the vaccine. Mm-hmm. But actually do make sense when you do actually listen to them. And it seems strange to me that governments, are manoeuvring the vaccine on these people when they're not even asking them why they might not want it.
Yes, I mean, I think the fundamental thing on this, the evidence does seem to suggest that the vaccines are quite good for elderly and vulnerable people, and that's fine, and I think we would all support that. But, the problem with hoarding vaccines, the mandates lead to hoarding in the West. As you say, people who might really need that in countries like Syria or in Africa aren't getting access to it. That's one thing. So the idea of universal vaccination is clearly a non-starter for so many reasons. We don't even have to go there. As we know already, the variants, and all of that, they don't even work after six months. And it's a boosted. So how is universal vaccination going to work? So, there's, and I suppose fundamentally it comes back to the kinds of inconsistencies that we've seen in government policy all along. You know, when you have fundamental inconsistencies, illogicalities, which everybody knows, then you're going to the only way of resolving that is a doctrinaire approach.
Yeah, I mean, it feels like that, and some of the tactics that have been being used now really make me question if we are still living in democratic societies. The mandate that Austria will make from the beginning of next year, making mandatory vaccines from February. What's going on in Greece with the fines that are going to start being passed on to elderly people over 60 if they don't have the vaccine from next year. I mean, blimey, this is different territory. This is a long way from initially when we were told, and then Spain and the UK, it was the same sort of thing. We were told that, you know, if we have the vaccine, we'll just protect the elderly, and then suddenly it's opened up. I think this
15 million jabs to freedom. That's the phrase I remember. So.
Yeah. Well, now it's completely different to kettle of fish, and it feels like it won't be long before we have we've got these people at gunpoint saying, you know, take the vaccine or we'll shoot you.
I mean, you know, it's hard to see how that could happen. Then it'd be hard to have seen 2 years ago how this could happen. But you know, I think, you know, coming back to the question of politics, and you know, we have clearly entered into times of extreme authority from government. Do you put that down to, as I've said, you know, the inconsistencies, the irreconcilable contradictions in policy, and the huge damage that has caused, and a desire to cover that up? Or do you put it, or is it also related to this? You know, this is a panic response, a hysteria, effectively. And you know, as a historian, I look back. You know, there are many episodes of hysteria in human history, many. And actually, I think of, you know, I wrote a book on the Inquisition once, and you know, there was a series of witch trials in northern Spain in the early 17th century, and then one of the clerics who was there said, you know, curiously enough, all the witches disappeared when we stopped looking for them. And I feel it's a bit like that with a lot of the things so do you put it down to the irreconcilable contradictions, or is it a function of a hysteria and panic, or both? What would you think about that?
Yeah, I do feel that there is this kind of justification. Governments are pushing through with this as if to say, we knew we were right and we are going to be right about this, and we're not prepared to bow to any other argument. So this is the avenue we've taken: lockdown, social distancing, vaccination, and we're not prepared to listen or take anything else into consideration. So I do feel it's like this really quite blinkered avenue that they've taken towards it, and I think they're going to go further with it, I'm afraid. I think next year is going to, you know, we're going to see a lot more discontent and a lot more resistance, because in many countries, you know, there's low vaccination levels, not quite what they would want. I mean, what's happening in, like I said, you said about the residue, we're already seeing this kind of resentment now, and what it's causing. You know, you just need to talk to people, and you know, some people are divided, and they won't let family members who haven't been vaccinated to come to their house, and you know, businesses won't let unvaccinated people come in to eat dinner. So these divisions, I think, are only going to be exacerbated much more. And I do think that the political vision is already set, and that's the way it's going to go.
So what's the role then of, you know, those of us in social sciences and in you know, those who work in public health, like other members of Collateral Global's advisory board? You know, what can we hope to achieve?
You know, Toby, I mean, I'm only grateful to at least have a voice to start with. In terms of achieving things, it's like the dissemination of these kind of interviews, of this kind of material, your work, my work, and you know, the slow. I guess it's going to be quite a difficult process as well. You know, do what we can to try and inform and advise, really. But obviously we're up against it, and this book is testament to how much we are, because we approached 9 publishers to get this work done, Toby, and 8 didn't even respond, and 1 said it was just a whiff of conspiracy. So it's a miracle.
Well, that's very interesting. You know, I mean, my book is a different story. You know, I wouldn't have even dared to approach 9 publishers with it. I wrote to my publisher who published it, Hurst, because I knew him well. And because he has a lot of background in Africa, and I thought he would be interested in a different perspective. But yes, again, I wouldn't have dared to even approach 9 publishers. So that's. But I think fundamentally, my feeling is, we are the middle ground actually, and we have to occupy that space until that becomes clear.
No, it's our obligation. I mean, there's no other way. I don't see myself, joining my colleagues and clapping on the restrictions, things like that. I think we have to carry on questioning things, and be there and be ready to represent, these really quite vulnerable, fragile populations, and at least document what's going on, because really, no one else is going to bother, to be honest.
Daniel, thank you very much for sparing the time. It's been great. And so Lockdown, Social Harm in the COVID Era is out now.